Hello, everyone, and welcome to 3 o'clock with SOC. Give me just a second so I can welcome those who want to access the program in Spanish to our conference call with Spanish interpretation. Buenas tardes, muchísimas gracias por estar aquí en 3 p.m. con SOC. Como siempre, ustedes pueden escuchar el programa en español a través de una llamada de conferencia. Y el número aparece aquí en la pantalla y es 646-749-3122 y el código para entrar es 779-328-221. Y ahora les voy a dejar con nuestra querida Marlene, quien va a ser nuestra moderadora de hoy. Thank you for letting me do that. I'm going to leave you in the hands of our beloved Marlene, who is going to be the moderator for today.
Hi, everyone. My name is Marlene Zaran, and I am the current Public Health Coordinator here at the Southside Organizing Center. We have a really great guest for you guys for today, and I'm really excited to interview her and see what she has to say. But first, let me just quickly say that we do have an interpretation line, and you can find that interpretation access information in the comments section. We'll also put it up as well, so you can call 646-749-3122, and then there's a code that you put in that is 779-328-221. Again, that will be in the comments section for you guys to access. These videos that we have for the SOC Live Forum can be accessed through our Facebook page. So we do have them recorded, and we will upload them in both English and Spanish for you guys to have access to. So that being said, I would like to welcome Peggy Gonzales-Charles. She is a physical therapist and pelvic health and pain specialist from Advocate Aurora Healthcare, and she's here today to talk to us about what every human should know about their pelvis.
Hi, everybody.
Hi, thank you for coming on today.
You're welcome. I'm looking forward to it.
Yeah, I'm really excited to learn all about this. A lot of people don't really understand exactly like how your pelvic health can affect your overall health. But I'll take that. I'll let you do all of the talking for that.
Okay, sounds good. Mm-hmm. Should I go ahead and share my screen?
Yes, go ahead and do that.
Okay. So, hello, everybody. I have this on present form now, and so I can't really see the people in the forum or the chat box. So if there's something that goes, if you have a question, go ahead and put it in the chat box, and then just I'll leave it to Marlene to kind of interrupt me, or we can save the questions till the end, whatever seems to be the most appropriate. So yeah, I am a physical therapist at Aurora Healthcare. I also do some health coaching as well on the side. And so my contact information is there. So if you don't get your questions answered by the end, I'm always available. Just shoot me an email. I'm happy to get back to you and then answer any questions that you may have about this or any other topic, honestly. So my objectives for you today is to become familiar with your own body. And so I'm going to be going over the anatomy for people with vaginas, and I'm going to go over anatomy for people with penises. And so we're going to see how we are similar and how we are different. I want you to know what is normal for the function of your bowels and bladder and sexual organs and what is not. And then I want to give you some ideas of what you might be able to do to help yourself so that you don't necessarily feel like you have to run to the doctor, or if you don't have immediate access, I hope to give you some ideas on things that you can do to help yourself. And then when you should seek extra help, and then share with you some resources for further learning. And so, warning, I want you guys to know that we will be using actual anatomical words, as you already heard me say, vagina and penis. And so some of those words kind of freak people out a little bit. And part of my job as a physical therapist and when I'm talking to my patients is I want people to be comfortable using the words that are actual words, right? I mean, we don't have any problem saying this is my shoulder and this is my knee and this is my foot. And so these are other body parts, just like any other body part, and it's just a word. So we will be using words like that, and I promise we'll all live through it. So First part of anatomy, and so I'm just going to use my cursor here. And so this is anatomy for someone with a vagina. And so the pubic bone is right here in the front. I hope you can see this, that I'm moving my cursor there. Right above the pubic bone sits the bladder. And then coming off the bladder is the tube called the urethra, and that's where the urine comes out. And then the uterus is here, and it sits on top of the vagina. And so this whole area down here is really not the vagina. The vagina itself is just this tube that attaches all the way up at the top here to the uterus, and then is the entrance is right through here. The rectum sits back here, and that comes through here to the opening called the anus. All right. So the rest of the vulva is what it is called, sits down here, and that has the outer labia, which are the kind of the lips, the opening of that that protect the opening to the vagina and the vulva. And there's inner labia and outer labia. So let's see. So as a physical therapist, so this is looking from underneath up, right? And so this is the pubic bone up here. This is the tailbone down here. These are your butt bones right here, right? Here and here. And so this is the muscle layer that that basically is what is my most interest as a physical therapist. So as a physical therapist who specializes in pelvic health, my job as a physical therapist is I'm a neuromusculoskeletal expert. So that means I work with nerves, muscles, bones, and joints, and I work to get all of those structures functioning the way that they're supposed to, so that you can start to feel better and get on with your life the way that you want to get on with your life. And so as a pelvic health specialist, I don't all of a sudden become an OBGYN or a urologist or something. I'm still just a PT. So my job really is to get these muscles functioning best, so that you have a better functioning pelvis. And so these muscles function, they have 4 functions. First of all, they attach at the pubic bone, as you can see up there, here, and then they come down and around and attach at the pubic bone. And so they're sort of a hammock shaped like this. And so the function of those muscles is for bowel and bladder control. So if you are not having great bowel and bladder control, odds are you have some dysfunction in these muscles, and we can work on that and make it better and have you regain bowel and bladder control. You don't have to, peeing on yourself, leaking urine, or bowels, feces, is not a normal part of aging. And so especially for women, I don't want you to think to yourself like, yeah, I've had a couple of kids. Now I'm like 50, 60, 70. And so, yeah, I leak a little when I cough or sneeze. Yeah, that's just how it goes. Well, no, that's not just how it goes. There's a lot that we can do about that. And we don't really need to support the adult diaper industry. And so these muscles also function for sexual sensation. So a tight pelvic floor might indicate pain with intercourse. A weak pelvic floor might indicate, less strong orgasm. These muscles function to support your internal organs. And so for a person with a vagina, those internal organs are typically a bladder, a uterus, and the rectum, like we just saw. And then we'll talk about anatomy for people with penises in just a minute. So, but also to remember that these muscles are part of your core. So, as people are working out, or if you have back pain or something like that, people might tell you, well, you got to strengthen up your core. Well, your pelvic floor is part of your core. And so it's your diaphragm above, pelvic muscles down below, abdominals in the front, low back and butt muscles in the back, that all form kind of a corset or like a girdle, really, that supports your pelvis and your low back, so that you can lift and carry things, reach for things, be active without hurting your back. And then most important for the function of these muscles as part of your core is to breathe. So when you are exercising or when you're lifting something heavy, it's important that you're not holding your breath when you do those things. So if you're picking something up and you're hearing noises like this, right, and then you're picking it up, or you're lifting a weight and you're picking it up and you're going, while you're at the gym, that's not a good way to exercise. So you are when you hold your breath like that, you are creating a lot of intra-abdominal pressure. That pressure pushes down through the pelvic floor, making it nearly impossible for you then to activate those muscles so they can function and support your pelvis and your low back as you're working out or as you're lifting heavy things around the house, including your children, right? So it's important to really breathe and coordinate your breathing with that, the core activation. All right, anatomy for people with penises. And so here is, again, pubic bone, bladder sits here. Down below the bladder is the prostate that men have and women do not. And through here then is the rectum and the anus. The male urethra way longer than the female, which is why females are more prone to urinary tract infections. And then the pelvic floor muscles sit here, just like they did in previous anatomy that we looked at. And so this is male anatomy. These are the same muscles we just looked at. Okay, so these are those same muscles. These are the butt bones over here, right? Pubic bone sits up through here. Tailbone is right there. And you can see how much narrower this anatomy is than this anatomy. You can see that the anatomy for people with vaginas, we tend to have much wider pelvises for obvious reasons. And then the pelvis of someone with a penis is much narrower. So May is Pelvic Pain Awareness Month, which is one of the reasons why I'm here today. June is Pelvic Organ Prolapse Awareness Month. And so we'll talk a little bit about pain, and I'll touch very shortly on pelvic organ prolapse as well. And then, Marlene, if you could let me know too, when I have about 5 minutes left, that will help. Okay, thank you. So is pain ever normal? And I would say no, pain is not normal. Pain is sometimes common, but that doesn't mean it's normal. And so if you're having pelvic pain at all, and so that could be bony pain, right? That could be, maybe you're having pain right at the tip of your tailbone when you sit for a long period of time. Maybe you're having low back pain or sort of pain sort of in the buttock area or your hips. So that might be coming from bony issues, or that might become muscular or something like that. Maybe you fell and you know you have trauma to that area and that's creating some pain for you. But pain can also be in the area that we just talked about, right? So pain can be in the vulva. Pain can be at the vaginal opening. Pain can be like rectal spasms and things like that. And so some of the causes for some of those things are tight muscles. And for, you know, just like some people carry their stress maybe up in their neck or their jaw clenchers and their jaw starts to hurt and they have a lot of pain in their jaw, or they have their shoulders are up here all the time and they start to have soreness up in the upper traps and things like that. Often the pelvic floor can be an area where people carry their stress as well. And so those muscles can be sort of tight and in spasm and create some soreness and pain too. And so from a therapy perspective, we use all kinds of different things to help people learn how to relax those muscles. And then we start to work on teaching them how to strengthen them. So postpartum scars can be a source of pain. So maybe you had a baby and you had some tearing, or you had an episiotomy cut during your delivery for various reasons, and they had to stitch that up. And so that can sometimes be sore or painful, certainly while it's healing, but then even sometimes that pain lingers for a little while. And so there's things that can be done about that. So if you're having pain that's lingering, you know, bring that to the attention of your doctor and ask them to see a physical therapist, and we can teach you we can help you with that and then teach you what to do with that as well. Sometimes these scars are not painful at all, but then you go through menopause and the decrease in estrogen makes these scars start to become painful so many years later. So even with menopause, if you're starting to have pain as well, often it's just the estrogen is way down in the tissues of the vulva, and they just need to, we can re-estrogenize those tissues with some different things, and then just kind of get the tissues healthier in therapy and functioning better. So again, hormonal and gynecological problems. So hormonal, like menopause, gynecological problems, like maybe endometriosis and things like that can cause it. Sexually transmitted illnesses can cause pain. Birth control can cause vaginal dryness because it creates hormonal issues, right? And so that can create pain. There's some different nerve sensitivities that can happen, and even prostate problems can create pain. So sometimes people have pain, people with penises have pain in this whole area, creating like scrotal or penile pain or rectal spasms, and they keep getting diagnosed with prostatitis and given antibiotics that aren't working. And so often it's really in the muscles. It's really not the prostate at all. So let's talk a little bit about normal bladder function. So is it ever normal to leak? No, no, no. It's the short answer. But what if you've had children? What if I've had 5 kids and I'm 60 years old and, you know, things like that? Or what if I've had 3 kids and I'm 30 and I'm leaking? No, that's not normal. There's help. So, am I going too often or am I not going often enough? So normal bladder function is urinating between 5 and 8 times a day. 5 if you're not really drinking a lot of water, 8 if you're drinking a lot of water. And so that equates to about every 2 to 3 hours, maybe every 2 to 4. If you're urinating every 4 hours, you're either holding it too long or you're not drinking enough water. So, but about 5 to 8 times a day, roughly 2 to 3 hours. And you should be able to hold it for 15 to 30 minutes after the initial onset of urge. So if you get an urge to urinate and you're running for the bathroom, feeling like you're going to lose it and you're not going to get there on time, that's not normal either. And so there's things that we can do about that as well. So am I supposed to hold my urine or am I supposed to go every time I feel the urge? So again, you should be able, when you feel that initial urge, you should be able to hold it for at least a little bit before you have to feel like you go to the bathroom. It's normal bladder function that if you hold it a little bit longer, the urge goes away. And then it'll come back the second time a bit stronger than that. And then your body might think to yourself, okay, well, now it's time really to go. But so it's sort of a balance. That question is, it's sort of a balance. You don't want to be running to the bathroom every time you have an urge because you don't want to be going every 30 minutes to an hour or something. But it's also, so in those cases, it's better to hold it a little bit and train your bladder to be able to fill fully before you go to the bathroom. But then it's not good to hold it for 3, 4, 5, 6 hours either. And I'm talking right now to my teachers and my nurses and my healthcare providers and people like that who tend to hold for way longer than they should. Bowel function. So how many times a day or a week should I have a bowel movement? Well, normal bowel function is having a bowel movement 1 to 3 times per day. So not 1 every 3 days or once a week. That is not normal bowel function. I don't care what your doctor's telling you. So should I need to push when I have a bowel movement? No, you shouldn't need to push either. So if you have a good, normal, healthy bowel movement, it should be sausage-shaped, soft, but well-formed. It should come out easy, clean up easy, in and out of the bathroom, not sitting there reading a chapter out of your book or an entire magazine while you're in there. And putting your feet up on a stool. So you guys have seen those squatty potty things or the step and go, those kind of products. Turns out that that's actually the best position to have a bowel movement. That all over the world, people are still squatting over holes to have a bowel movement, right? Well, we're not going to get rid of our toilets and just have a hole in our floor of our bathroom. So the best thing to do is put your feet up on a stool. That sort of puts your body in that squat position, and it makes having a bowel movement way easier. But better than that is, how do you get more regular? Lots of water, good fibrous foods with both soluble and insoluble fibers. So look those things up. Good exercise, movement gets your intestines moving and your whole GI tract moving and gets things moving and flowing. And then good healthy fats as well kind of help get things flowing. It's a couple of really great YouTube videos. One of them is called How to Have a Great Poop. And the other one is called What a Great Poop Looks Like. And so they're really great, entertaining videos. And all the links should be on the Facebook page later on today. Actually, they might be there now. So those are some really great things to watch. So how can you help yourself? So first of all, right now, everybody take a good deep breath in. Let it out. And do that again. Let it out. So I have my patients download an app to their phone called Mind Bell. And I don't have that in the resources. So I don't know if maybe Marlene or Gabrielle, if you kind of add that in there. But Mind Bell is an app that you can set to go off as often as you want. And it's a chime. It's just a chime. So you don't have to then find your phone and turn off an alarm or something like that. It'll go ching just once and it'll stop and then it'll go off again in an hour if that's when you set it. So I'll have my patients, especially the ones that have really tight pelvic floor muscles or their jaw clenchers. Because if you're a teeth grinder, jaw clencher, if you're clenching here, odds are you're clenching down here. And, I work on my patients to correct that. So when the chime goes off, they take a nice deep breath in, they take inventory of their jaw and their shoulders and their pelvic floor. Just let everything go. And you take a couple of nice deep breaths in, let some stress out as you do that. And so I have them start with that. And then some exercises that you can do to strengthen up these pelvic floor muscles. If you think you're a clencher, don't do these because you're just going to make yourself clench that much more. But if you feel like your pelvic floor muscles are probably weak, and an indicator of weak pelvic floor muscles are urinary incontinence, fecal incontinence means leaking. So if you're leaking at any of those times, odds are you have a weak pelvic floor. Or if you used to have stronger orgasms and now you have had some kids and they're not as strong, it's probably a weak pelvic floor. So if you've had any injuries or things like that. But so for right now, let's go ahead and do some exercises. So some quick contractions. It's important for these muscles to be able to quick contract and work.
You have 5 minutes.
Okay, so it's important for these muscles to contract quickly so that when you cough, laugh, or sneeze, they know how to come in. And so for right now, just sitting here, as you're sitting here, go ahead, tighten your pelvic floor and let go, and tighten and let go, and tighten and let go. All right, you can do like 10 of those 3 times a day. Great exercise. And then you can do some longer holds. So with these, I want to coordinate your breathing with these a little bit. So I'm going to have you inhale. As you exhale, you're tightening. Tighten those muscles and hold it. 2, 3, 4, 5, and let go. And you can do 10 reps of those and do those 3 times a day as well. And then I then teach my patients not just to sit there and do pelvic floor exercises, but to use your pelvic floor when you're squatting, when you're lifting, when you're going up and down stairs, those types of things. So some of the things that are helpful too are if you're having pain and you need to maybe stretch the tissues a little bit, are dilators. And those are some resources on where you can get those. And they have the reason I like these resources because it has good information on how to use these things. If you're feeling like you need to use these, honestly, I would say get some physical therapy so you can have some professional guidance on how to use it. But other ways to help yourself are a good, healthy lifestyle so that you're pooping and peeing the way you should, and that you have good, healthy muscles, and that you're exercising or creating some kind of movement throughout your day. So these are some of my favorite links. And the first one is the book that you see there called Between the Hips. So actually a friend of mine wrote that book, and she wrote it because she did a lot of studying to sit for a certification exam as a pelvic health specialist. And she got kind of angry that she knew all this information and that most people don't know this information, and it's important to know. So she decided to do something about it, and she wrote this book. She also comes from a really small town up north, and she knows there's not a pelvic health specialist for probably about 2 hours away from where she lives. And so she wanted people to have this information so they could help themselves as much as they can, and then be able to seek professional help if necessary. And so we also know that in our Milwaukee area, we have a lot of people that don't have access to care as well. And so this might be a really good, inexpensive, it's definitely less than $20. And the Amazon link is there as well. And so it's an inexpensive way for people to learn more about their bodies. It's written for women, but again, the bladder and bowel stuff she has in there, and even some of the muscular advice that she gives are the same as for people with penises. And so it's just a really great resource that I love. And then some of these websites here, pelvicguru.com, that's where all those pictures came from. And it's a PT that runs that site. And she's got really great resources for people as well. And where to find pelvic health professionals all over the country. And then the sexualityresources.com, vuvatech.com, those are the resources also that were on the other page for the dilators. And so that's it. That's what I have for you. I'll hit escape here so I can see you guys again. And if you have any questions for me, I'm going to just stop sharing. So
Thank you so much, Peg. That was such good information, and I learned so much. I didn't know all of that before, so thank you. I actually was just telling Gabe that my mom had 6 kids, and sometimes when she's walking around or she laughs too hard, that she'll kind of pee a little bit. And I looked at her, I'm like, I don't think that's normal, Mom. You should try to get it checked out. So now I know she should get it checked out. So I'll
she should get it checked out. Yeah. And so there's some Advocate Aurora has pelvic health specialists at West Dallas, at Aurora Sinai downtown, at the River Center Clinic that's on like Pleasant Street, over by where Lackey and Joy's used to be. And then I'm in the Franklin Clinic, and where else do we have? Oh, 84th Street. So we have lots of pelvic health therapists now. And so good access kind of all over the city.
Awesome. Thank you so much for your time. Is there anything you'd like to add before we conclude?
No, just honestly, I'm okay if anyone wants to email me with questions or anything like that. And so, yeah, I guess that's all I have.
Awesome. And Gabe shared a comment. She said, I'm so grateful to have such a knowledgeable mama.
Yeah. And I, when my friend wrote that book, I got a copy of that for each of my daughters and my future daughter-in-law. And so, you know, so I don't know if my son's fiance knows what she's getting into.
You're gonna give her all this advice whenever she has questions.
Yeah.
But thank you so much for your time. We'd love to have you on again, moving forwards in the next coming weeks or months. But yeah, thank you for coming on as a guest.
All right, I would love to be back. So thank you so much for having me.
Thank you.
Bye.
Bye. All right, that was such good information. I really appreciate Peg for coming on and sharing all of this information with us. We tend to not really think about our pelvic health a lot and how that can be contributed to other factors and pain within our body. So it's important to really look into that, because sometimes physical therapy is the way to go when there's a small solution. All right, so that being said, I'm going to share with you guys a link for how you can find out about travel restrictions in other countries during this time, because I know some of you might be getting fully vaccinated and a lot of individuals are starting to travel again. You know, be very cautious if you are traveling, and, you know, continue wearing a mask, stay 6 feet apart. But let me share my screen so you guys can see that. So this is the travel.state.government from the U.S. Department of State, Bureau of Consular Affairs. So on this website, you know, you have all the information for U.S. passports, international travel, U.S. visas. If you scroll down, you will see this little box here where you can learn about your destination that you're going to, and you can put in a country. So I'm gonna pick Jordan because I have cousins in the Middle East, and my mom was actually talking about going, and I told her no. But see, okay, so this country, Jordan, in the Middle East, if you look at this travel advisory level, they have it ranked from 1 to 4. 1 being the least amount of caution you need to take when you're traveling regarding COVID, and 4 being the highest amount of caution you need to take. So essentially 1 is exercise, normal precautions like wearing a mask, staying 6 feet apart, and washing and sanitizing your hands. 2 is exercise, increased caution, so just be extra cautious when you're traveling. 3 is reconsider travel, and 4 is do not travel to this location at all. So when I put Jordan in, I got this saying do not travel. So it says, reconsider travel to Jordan due to COVID-19, exercise increased caution in Jordan due to crime, and some areas have increased risk. So these are just alerts. There are currently no vaccinations there. And so it gives you all of these quick facts that you need to know. Yeah. So, and then it even gives you like embassies, consulates, safety and security. Yeah. But I've traveled to Jordan many times. It is not dangerous, but it is dangerous right now regarding the COVID-19 vaccine. And then it gives you like assistance of who you can call to get more information. Yeah. So I thought that was really interesting for individuals that are considering traveling. And it really helps give people a perspective of the country they're going to before they actually go to it. And we have that link for you guys in the comment section as well. I want to also share some information about the SOC website where you can see all of our coronavirus information. So if you go on our main page and then you click you click COVID information, you can scroll down and our site is in English and Spanish, so you can convert it to Spanish by clicking here. You can scroll down and you can get the latest information about COVID-19. We have multiple websites here, so if you want to figure out like gating criteria, you want to figure out Wisconsin COVID-19 rates, you want to figure out Milwaukee County COVID-19 information, click on that. And you can, it'll take you right to the Milwaukee Public Health Department's page where you have access to vaccine links, the link to vaccines and getting registered to vaccinate, testing locations, and administrative orders, news releases, everything regarding COVID-19 on one page. And then you also have the Milwaukee Public Health Department's dashboard. And here you can check out all of the COVID-19 numbers and what that looks like right now in Milwaukee, which I will be going over tomorrow. So that being said, I just want to let you all know who we have tomorrow as a guest. So tomorrow we are having Dr. Sergio Gonzalez. He is the Assistant Professor of History and Languages, Literature, Arts, and Cultures at Marquette University. He's going to be discussing Latinos in Wisconsin, Latinos in the labor movement, and the role of culture, religion, and language in the Latino diaspora. So very excited to listen to that and to learn more about that from Dr. Gonzalez. And that being said, I leave you all with a survey promo that we have, but we will see you all tomorrow. Thank you.
Has this live forum been informative and useful to you? What part of the forum could be improved or changed to make it better? Please take a quick survey that's located in the comments section so that we can keep 3 o'clock with SOC going for residents. Thank you for tuning in.